Okay, so the O2, the CO2 added blood comes into the right atrium, and then it comes into the right ventricle, and then it goes to the pulmonary artery, and it goes to uh, um, our lungs, and lungs purifies it and expels out the CO2, and then O2 blood comes in the heart through pulmonary vein. It comes into first left atrium, then comes in left ventricle, and then it goes to the aorta, and it gets distributed in our whole body. So now, where is the problem? Actually, there when in case of ventricle septal defect, this is the septum of the heart, right? So septum of ventricle, so there is a hole in there. So what happens that, when CO2 bloods come here, goes here, purifies it, and then enters here. So there is no problem occurs in case of this, right? And there's also no complication in the body because CO2 is going out, O2 is coming in. But the problem starts from here, when O2 blood comes here, and then it comes here, okay, and then it goes here. So there, this part of the heart is associated with O2 blood, and this part of the heart is associated with CO2 blood. So what happens that a little by little O2 blood enters this part. So what happens that the little O2 blood gets added with the CO2 blood, and it again goes to the lung does its work and just comes back. But when it left untreated, what happens that the shunt reverses. Like, what usually happens, the O2 blood from the left ventricle goes into the right ventricle, but when it left untreated, the CO2 blood right from here start to enter in the left ventricular. So what happens that this blood then goes into artery, and it goes in the whole body. So what happens, cyanosis occurs because spo2 level drops, because there is there is CO2 amount of blood in the aorta. So there the complication happens, and when this complication starts, the name of the complication is Eisenmenger's complex. And after this, the surgery which is done for a ventricular septal defect is the closure of VSD by cardiac catheterization. Can't be done once the complex occurs.